Minister in the PM's department, Dato' Wee Ka Siong, announced that they will increase the intake for the medical students in the public university from 919 to 1019. There is an increase of 100. However, despite the increase, if you compare with the total numbers of students that is enrolled into the medical faculty in the public university, actually it has been reduced substantially. In the year 2012, the total number of students admitted to the medical schools in public university were 2,619. And in the year of 2013, the total number of students admitted into the medical school is 2,027. So if we compare the total number of students admitted into the medical schools this year with the number of 2012, there is actually a reduction of 63%. And if you compare with the figure last year, there is actually a deduction or decrease of nearly like 50%. And the reason behind the decrease actually is because our public hospital it cannot cope. We don't have enough capacity to train that many trainee doctors, or we call it medical graduates. And therefore, the question now is, okay, this year there are 1,019 students admitted into the public university, the medical school. Also in the private sector, there are 8,344 students admitted into the medical school in the private institution. So altogether for this year alone in Malaysia, the medical students in Malaysia, first year medical students in Malaysia, the total number is 9,363. Okay? And I got another piece of answer. It was given by the Minister of Health. Okay? In that piece of answer, he mentioned that the houseman currently in the hospital has actually increased. Okay? In the year 2012, the housemen or the trainee doctors in the hospital is 3,743. And in the year 2012, that was last year, the number actually was increased to 4,991. There is a sharp increase of 33%. And in the same answer, he also provided the projection for the numbers of medical graduates in the coming 5 years. And you can see that in the year 2019, in their projection, they estimate that they will be medical graduates, the total number of the medical graduates will be 5,968. However, we all know, all these first year medical students this year, they will graduate in the year 2019. Okay? And the first year medical students this year is already more than 9,300. Okay? And don't forget about those students study medicines in overseas. They will come back, and if they want to come back to practice, they need to receive training, 2 years training in the government hospital as well. So if we add out those study medicines in overseas, the total number that will come back and need to get the housemanship in the public hospital would easily more than 10,000. And if we follow the projection by the Ministry of Health, that means that easily there will be 40 to even 50% of the medical graduates, they won't be able to get housemanship in the public hospitals. So to me, this is a classic example that the right hand of the government don't know what the left hand of the government is doing. And therefore, I urge the Minister of Education and also the Minister of Health, they need to sit down and discuss and talk about the future of all our medical students and also our medical doctors. Because we don't want that we produce so many medical students and eventually they will have a problem to receive enough training and to be admitted or to be able to practice as a medical doctor. So I think if they do not sit down and talk and find solution, I believe that many of the medical students, their future will be jeopardized.